Okay, Carolyn, how are you?
I'm good, thanks.
So could you tell us your name and your connection with SHC and what time you were involved in your role, please?
Sure. My name is Carolyn Burr, and I was with Student Health Coalition in 1970 and 1971. That first year I was single and got engaged toward the end of that year, and in the intervening year was then married. Thus I have a couple of names in process. So.
Okay, I see.
Sure. I was a nursing student, so the first year was after my junior year in college, and then the second summer I had graduated, so I was a graduate nurse and took my nursing boards during that summer.
So, so what was it about the project that made you want to become involved with it? Sort of, could you just talk about that briefly?
Sure. Actually, my then boyfriend, Dick Burr, and John Davis saw an announcement or heard from someone about this organization, and so they actually went to the first meeting where I knew about it, and they came and said, there's this group of folks, of medical students who are going to be organizing in Appalachia, and we think we want to do it and be community organizers. So I started then going to the meetings, and I think it was sort of the times. There were a lot of social action things going on, a lot of anti-war stuff. Sort of not the height of the civil rights movement, but still civil rights activity going on, and the beginnings of the feminist movement. And plus, I think it just seemed like this was a way to really to think about nursing practice in a different way from the sort of traditional go be a nurse in a hospital kind of thing. And I was interested in that, and nurse practitioners were just barely on the scene, had just been sort of invented a few years before, and so the notion of what a nurse practitioner might do was really enticing too. And there seemed to be some opportunities around that with Student Health Coalitions.
Okay. So you okay. I actually answered a lot of questions. So did you, and if you could just talk about it a little more, and again, I just sort of asked people this because of the time you were talking about, did you see it as sort of something that spoke to you within, or was it more of the activism of the time, or was it a combination of things? I
think it was a bit of both. It was certainly a way to kind of live your activism in a way that you couldn't do, marching and demonstrating and holding vigils and things like that. It was more of a way of, kind of really living out your values in a way that, and using some, fledgling professional skills to do that. So I think that was a lot of it, but also there was an opportunity, I think, for some personal growth too.
Okay. And then how did you feel about the overall approach to healthcare that SHC provided, and did you think it was good? Did you love it? Did you?
I did. Yeah, I believed in people being involved in their healthcare. I liked the notion of having community individuals be a part of the planning for their health, getting people involved in that and really taking ownership over their health. And yeah, I think that was just it was an approach that I felt really comfortable with.
What is it that you think that you learned in doing this that you carried with you through your professional work?
That's a big question.
Well, sort of start small, like what, sort of interacting with the people and things you learned about working with people who you may had a different impression of, and sort of the things you took away from that.
Some of it was very, very much how you saw yourself as a professional and how you did your work as a nurse. And I remember very distinctly that one of Dr. Christie's sayings was, when in doubt, look at the patient. Well, that seems really obvious, but even in those times, there were so many lab tests and so many ways of evaluating people coming up that that it was really easy just to look at all that stuff and lose the patient and lose the family in the shuffle. And that's something I've always carried with me. You know, look at the patient and listen to the mom. Those are the people that know what's really going on. And I think that has really grounded me as a nurse practitioner and, you know, a pediatric nurse practitioner. So that piece, and that sort of respect for the patient and the family, I think carried through to the larger policy arena too, that people, that whole notion of patient-centered care, which wasn't even a term then, but that's what we were practicing. And that has really, you know, sort of come into its own in the last number of years, and it's sort of resurfaced again. But that's really what we were doing. It's like, how do you make the patient, how do you help them be accountable for their own care, but how do you make them the center of the care as well? And how do you, your professional role is to move that person along toward health, and not simply to just, you know, hand them things that will get them there.
I love that. Listen to the patient and listen to the mom. How did you learn could you talk about the tasks that you did when you were with SHC
Sure.
and how you learned them or who you worked with to learn them?
Yeah, the first summer, I was a community organizer with a colleague, with Dee Dee Schmidt, Wyatt, in Smithville, Tennessee, so just outside of Murfreesboro. And we had a health fair there, and then we did the follow-up to the health fair. And we lived in a little rented house, so we didn't actually live with families there. I think because, I'm not sure exactly why, I think maybe because it was a really early health fair, and so we didn't have a way to establish those relationships. So that we were doing that, but then we also worked at the health fairs in other places. So some of the times we were in Smithville, and some of the time we were, you know, I know we went to the White Oak Fair, and we went to Bryceville, and I think we went to the one in Deer Lodge. And so there was an orientation first, where there was a lot of, you know, skills were taught and that sort of thing. And I missed the beginning of that in 1970 because I'd had surgery, and I was home still recovering, and so I missed some of that. So I'm sort of playing catch up with some of those things. But you know, the nursing students were learning to, you know, listen to hearts and look in ears, and pretty radical stuff that nurses didn't do at that point. So I was catching up a little bit, and I remember listening to heart sounds with Rick Davidson. That was before there were, you know, now you can listen to tapes to your heart's continuum. I'm sure you can do it on the internet, but at that point, you had to listen with somebody, and you had to listen to real hearts to learn how they sounded, and hope that you heard a variation here and there, that somebody could say, okay, there's an S3 sound, because there weren't any tapes to listen to. And other kinds of physical exam. I can remember doing glaucoma screening, using a little thing set on people's eye to test the pressure in their eye. And I managed at some point to scratch somebody's cornea. And I was horrified. I sort of decompensated for a couple of days about that I actually hurt somebody in the process. And I remember Rick saying, it's really okay, they're really going to be fine. And somehow he was sort of my supervisor at some point. He seems to appear in these stories. But I'm sure the lady did fine. We gave her some eye drops and she did fine. But I did.
That's good.
I do that. Hurt her.
Did you teach anyone in the community what you're doing, or people who would carry on what you were doing after you left?
Yeah, the second summer, there was a clinic in Deer Lodge by then, and there was a doc that came once or twice a week, and I was sort of the nurse in the clinic. But we had a community health worker that worked with us, and she actually had a salary. She was paid maybe by the agriculture or extension agent, somebody like that. And so she was doing nutrition teaching, but she was also doing some health promotion along with that. And so I remember teaching her some things around, you know, prenatal things and, you know, working with moms that were pregnant. And she was doing the nutritional piece and taught her some other things to kind of help moms in that prenatal period.
I have to cough. Excuse me. So, what did you, in what ways, if any, has the SHC experience influenced your life? So my question was going to be, what did you miss about it after you left, and what did you carry with you from that after you left? So when you first left, what did you miss about what you learned or the people you met? And then how did you carry some of those values that you learned from the people that you worked with and helped when you were there?
Yeah, yeah. I think, what you miss is that real sense of community, both with, the group of folks across the hall, the people who were actually, the students who were working in it, because there's a really diverse crowd, it was arts and science students and nursing students and medical students and law students, and it was a really interesting, intellectually interesting group of people. So even hanging out on the weekends, it was just a really interesting group of people to be with. And there was a lot of, sort of putting this in context. There was a fair amount of fairly high-level conversation that went on about what we were doing and why we were doing it. So I missed that, once I was back in sort of a 9-to-5 job, particularly this, the second year, because I'd graduated and I was out in my first nursing position. Certainly the things I carried with me were that view of patients and families and how you worked with them, and a real commitment to working in the community. 40 plus years of being a nurse, I've never worked in an inpatient unit, nor do I plan to. And I think a lot of that is from Student Health Coalition. I've always seen myself in a community role, whether that's, a sort of a classic public health nurse for a while. I worked in rehab, and the last quarter of a century or so, I've done work around HIV and AIDS with prevention of mother-to-child transmission and taking care of children and families with HIV. It's very much community-based, even though people do end up in the hospital. But I ended up as a nurse practitioner doing ambulatory care and then doing a lot of public policy work over the last quarter of a century. And I think that's a pretty straight line from those lessons learned in Student Health Coalition. And the idea that you can make people's health better by working not only at an individual health level, but at a community level and at a policy level, and that those things were tied together in a way that you could really impact as a professional.
Okay, 2 more questions. They're sort of connected. What were you looking forward to coming here this weekend, and what do you hope to accomplish from being here this weekend? Mm-hmm. And it can be, whatever. I mean, it's like what.
Yeah. Well, I'm certainly looking forward to reconnecting with the people again. I had come to the reunion a few years ago, and it was fun, but I think I just didn't get quite enough, didn't have quite enough time with people, and so it was worth it to me to come back. And maybe what I hope to take with me is just a sense of renewal of that sort of, what I just articulated to you, that notion of personal health and community health and the impact of public policy. That's still what I do, and some days, it's harder to see those connections on the bad days. And so this is sort of renewing in that sense, I think, of making those connections.
Well, and I do have one more question. This is sort of kind of a personal, I mean, I teach some classes at Belmont, and I sort of ask my students questions about what's sort of happening in the world, and they're not. So what would you tell a group of students, who maybe were thinking about being, activism or being involved in something that really would change their lives? What would you tell them if you're speaking to a class today or talking to someone who is interested in this? Or how would you, it's a different way of thinking, and it's a selfless way of thinking, and so how would you try and connect with? I mean, that's a difficult question, but
yeah, I think there's sort of 2 pieces of it. One is to try to make the case for the fact that you can use your talents to make the world a better place for individuals, for communities, and even the really bigger picture pieces, and persuade people that that's an important way to use your talents rather than just, drawing a paycheck. But that the benefit for doing that is a lot of personal reward and personal growth, that you learn things about yourself, you learn about other people, you let people into your life that help you grow in dimensions that you can't really imagine, because you've reached out to people and you've offered them some part of yourself, you think, but in fact what you get is a whole lot in return for that. Certainly was my experience in the mountains, and that's been my experience in working in HIV and AIDS, is that there are just a lot of unexpected benefits, both from clients and from the other professionals that I work with. A lot of the work I do now is educating other professionals, and so it's not direct with clients, but it's helping people improve their practice, knowing that that's going to improve the care that they give to their clients. So it's a little, it's sort of one step removed, but you still feel that, you feel those positive impact on your own life from the work that you do. So I would hope to persuade young professionals of that.
Great. Mary Ruth, anything else?
No, but Carolyn, that was lovely. That
Yes.
was lovely. So articulate, so beautifully